Good afternoon. My name is Maggie Blay. I'm one of the counselors here at Reliant, and I'd like to introduce you to Jerry Jeswald. Many of you may know him. He has done lots of talks for us. He has been a consultant and trainer on the West Coast since 1983. Presently, he is at Serenity Lane. He's done many trainings for us on reasonable suspicion for HR managers, and we'd like to welcome him here again. Thank you, Jerry.
Thank you, Maggie. Good afternoon. Obviously this is a topic that's of great concern to a lot of employers today, and I know I've received a lot of calls over the last few months in regards to, and in most cases employers would say that they're going to handle it just like they do alcohol. There are some reasons you're not able to do that, but that's not to suggest that you can't ban the substance and people being under the influence. So what I've got is some slides. For those of you that have attended my reasonable suspicion class, the first couple of slides are kind of redundant, but one of the things I like to point out is that we all have a natural desire to alter our state of consciousness, and how we do that can vary significantly. Obviously, the healthier way to do it is to do aerobic exercise and things like that, but it's the same kind of thing that we're pursuing when we do that. All mood-altering psychoactive substances, including marijuana, have side effects. I've used many times as the example prescription drugs. When a person sees a 30-second commercial on a television ad for a prescription drug, 5 seconds tells you what the drug is, and the next 25 seconds tell you the disclaimers and side effects. And in the last few years, the word fatal and death have been used sometimes 2 and 3 times in a 30-second commercial. So some of the side effects that are going to occur are paranoia, anxiety, depression, drug-induced psychosis, and other kinds of antisocial behavior. Now, looking at marijuana itself, let me just say that one of the side effects of marijuana is longer term, similar to prescription drugs, frankly, in that it lingers. The high occurs in a period of time, and then there are some things that occur in the brain that causes the brain to have some impairing issues going on beyond the actual high of the drug. And some of those can be for a fairly long period of time. Problems with marijuana: THC is fat soluble, which is the active ingredient that causes the high. The brain is the single fattiest tissue in the body, so it's not an accident that we sometimes see folks that have been chronically or long-term users of marijuana that they have some memory issues. Oftentimes the lights are on, but nobody home. So that is something that is, again, residual and longer term, which creates problems as it relates to, coming to work. The argument you hear from a lot of the folks today that since Oregon has legalized the recreational use of marijuana, is now that it's legal, I'm not doing it on the company time, and I'm not doing it in the workplace. So, what I do on my time is my business. Well, there's some things that we're going to learn, I think, and that's probably one of the other things that I see as being a positive out of the legalization, is that we are going to see more scientific studies. And 5-10 years from now, we're going to know a lot more about this drug than we do today. Heavy use can lead to thinking errors, and when that comes to locking out and tagging out in a highly industrial setting, that can be a problem. But changes are a lot more subtle. It's something that is gradual, and it's not like a methamphetamine, where the changes can be more dramatic and more noticeable, both physiologically and behaviorally. So marijuana is kind of become, because of this, a more socially accepted drug, and I'll have a slide on that later on. Some of the symptoms of possible marijuana use are going to include it adversely affects judgment and decision making. There are some motivational issues that can sometimes, and I want to make sure that all the listeners understand that that's not the case with everybody. Just like with alcohol, it's going to affect people differently. But these are going to be some of the indicators of an individual that does develop a substance issue with marijuana. They have a difficulty staying focused and staying on task. They minimize complacency and can't understand why you don't understand why they don't come to work. Their memory issues, both short and long term, that can be adversely affected. And then some of them have a difficult time going out and socially interacting, again, because of what the drug's doing in the brain. There's two schedulings, there's actually more schedulings, but two primary scheduling of drugs under the federal level. One is Schedule 1, and what a Schedule 1 drug is that there's no recognized medical use. A few years back, when several states, Oregon included, passed medical marijuana initiatives, the DEA and some of the federal agencies were kind of rattling the sabers that if doctors were going to recommend marijuana for medical use, that they have the risk of losing their license. It scared a lot of doctors. Finally, there was a U.S. Supreme Court decision that even though it's not recognized as medical for medical use or recognized for any type of medicine, and probably the most common one we see today is for pain management, and some of the seizure disorders. A Schedule 2 drug, which are going to be most of your prescription opiates, etc., that's a drug that has recognized medical use, but it also has a propensity for developing a substance use disorder of some sort. Might be a mild one, could be a moderate one, it could be a severe one. I was called the day after Measure 91 passed numerous times by radio stations around the state, and one of the things that they asked me is if I thought because of the legalization we were going to see less in the black market, and my answer in each of those cases were no. There's still going to be a black market. In fact, there was a recent CNBC special, I think it was, that in Colorado, and there was a gentleman that which kind of surprised me in a sense. He didn't hide his identity at all. But in 2014, he announced to the interviewer that he made over $1 million on the black market last year. And of course, Colorado has legal recreational marijuana as well. So how did we get here? I want to talk about, the past. I want to talk about the present, and the future, of course, has, many question marks because we don't know what's going to happen as it pertains to the workplace. I think all of us want to take on a hope, at least, that there's going to be sensible decisions that come out of any challenges. That's not necessarily, when the challenges were made on the medical marijuana side, it took about 7 years. I served on a legislative subcommittee that was addressing the medical marijuana issue because many of you employers were having difficulties when somebody would test positive and then somebody would reach into their pocket and pull out their medical marijuana card. So until the Oregon Supreme Court ruled on it in April of 2010, there was both the Oregon Court of Appeals and BOLI, Bureau of Labor and Industry, had ruled that, number one, employers have to engage in dialogue if a person's got a qualifying medical condition and they're using marijuana legitimately for this qualifying medical condition. And then we came to our senses, like I say, in April of 2010, and the Oregon Supreme Court said, wait a minute, we're not going to fly in the face of federal law, so therefore employers, no, you do not have to accommodate the medical use of marijuana. I'll have a slide on it later on, but one of the things that we have going against us currently as it relates to employment law is that we don't have a case law yet as it relates to employment and possible disciplinary action that's taken against somebody that tests positive in the urine. We'll talk about that in a minute too. Historically, back in the 70s, Oregon was one of the first states that made the possession of less than an ounce of marijuana a misdemeanor. It was a $100 fine. Those of us that were around in the 70s will remember that marijuana was sold as a lid in a sandwich baggie. Those would all measure out at just less than an ounce. we were talking before we got started today, and as was mentioned by myself at least, that if you were out there marketing marijuana of the quality in the 70s, you'd probably get hurt because it was maybe 2-3% THC. The marijuana out there today is significantly more potent than that. Oregon became the second state to make medical marijuana legal, again for qualifying medical conditions. California was the first. And then in 2010, many of you probably don't know about this, but the Board of Pharmacy at the request of the legislature actually changed the scheduling of the drug in the state of Oregon from a Schedule I to a Schedule II drug. And if you'll recall, Schedule I is there's no recognized medical use. Schedule II, there is recognized medical use. Kind of a little side story, I was asked if I would go up and testify at a hearing with the Board of Pharmacy that they were going to have as it related to changing the scheduling, and I said I would. And I don't remember what the date was, but it was a Friday afternoon at 1 o'clock. Friday afternoons, I kind of like to play golf, so I had kind of volunteered my time to go up and testify. So, and I do a lot of work with the boards and medical boards, healthcare professional boards, and I walked in and they said, how come you're here? And I said, well, I'm here to testify at the hearing at 1 o'clock. And I said, I'm sorry, Mr. Jeswell, we changed that. It was held at 11 o'clock. We've already had it. So, you know, these things change, I think, in some, and they did vote on it, and they voted to change it from a Schedule I to a Schedule II. We all know what happened last year, and that is that Measure 91 did pass. And the passage was, you know, fairly significant. So the voters have spoken, and they've said that they see no reason why marijuana shouldn't be legal for recreational use. And then October 1st, just a month ago, a little over a month ago, the medical marijuana dispensaries that were allowed to began selling recreational marijuana to those that are 21 years of age or older. There are some cities and counties that have voted to ban recreational marijuana, and in some cases, recreational and medical. And so in those cases, most of those are going to end up being on the ballot probably in November of 2016. An example, or a couple of examples of the acceptance of marijuana, 8th and 11th graders in the state of Oregon are more likely to smoke marijuana than they are tobacco. Now, that's kind of a good news, bad news piece of information. They're getting the information, you know, and staying away from tobacco, but because marijuana gets them high, obviously they like that. And we do have card holders as young as 12 years of age with parental permission. So, you know, it's unfortunate, but there are a lot of people out there that see this as a completely benign drug. And, you know, I'll go back to what I said early on. All drugs have side effects. In fact, if I were going to really point out one of the greatest concerns I have, it's for the adolescents as it relates to the exposure to and the use of marijuana and what it's going to do to their developing brains. We'll talk about that a little later. The medical versus recreational. Basically, if you're going to use marijuana medically in the state of Oregon, you have to have a qualifying medical condition. You have to have a doctor that will sign off on your application that, yes, you indeed have this qualifying medical condition, and then that application is submitted to the Oregon Department of Health, and the Department of Health then issues that card the most of the time. In the case of recreational use, the only qualification is you need to be 21 years of age or older. So once you reach your 21st birthday, you can walk into a marijuana dispensary and show your ID and purchase it. One of the things that I think about as it relates to that, I think most of us know that young people oftentimes have fake ID, and they get that fake ID so they can go into a bar and drink. I'm sure the same thing is going to apply with marijuana for some kids. I already mentioned the black market. Reasons to be concerned. Number one, the levels of THC in the marijuana today. We were talking a little bit earlier before we started that the butane honey oils, also recognized or called hash oils, can have concentrations over 90% THC. that's significantly different than, pot of the good old days. We do not have clarity regarding someone that is currently impaired. We can measure the presence of the metabolite, but you can't determine when somebody's actually impaired like we can with alcohol. And that's the significant difference. Presence of the drug, all the court decisions in terms of challenges have been in favor of the employee or the individual, that a urine test merely indicates that the person has previously used the drug, but it does not indicate that they're impaired. There's several court decisions that have ruled the same way. And then again, as I've already mentioned, the adverse impact that the drug use will have on the adolescent developing brain. The brain develops till about age 25. I was at a recent conference where if we want to, try to impress upon young people to not use, or if they're thinking that they want to use marijuana, the best advice to give them is wait until you're 25 before you do it, because the damage you're going to do to your brain is going to be significantly less. There are some studies in New Zealand, Australia, I'm not sure which, where they've shown that the IQ reduction of adolescents can be anywhere from 8 to 10 IQ points. If you've got 150 IQ, 8 to 10 ain't going to harm you. But if you've got 90, you're in trouble. And I think that's kind of, in fact, there's one professional nationally that says if we did urine screens on the 30+% of kids that are dropping out of high school, you'd see a very high percentage of them that would test positive for marijuana. They lose interest in school and they stop going and drop out. Kind of like when they don't feel like they want to come to work. They just don't and can't understand why it's a problem. The disconnect, obviously, is between federal and state law. And one would assume that federal law would trump state law, but that's not necessarily the case. And the challenges, I think, will come at the state level. Our biggest concern, my biggest concern, is down the road, how many other states pass similar initiatives that Oregon, Colorado, and Washington have, and the District of Columbia, and Alaska. But the more that do, we're eventually going to get to some kind of a number that the feds are going to have to look at. In fact, probably the most significant concern that we have to have as employers and as citizens is whether or not the federal government changes it from a Schedule I to a Schedule II drug. There's a lot of pressure being put on, the Congress and Senate in Washington, D.C. to do that. And it's primarily driven by the CBDs that I mentioned earlier. And if that were to happen, as Paula Barron, who's an attorney here in Portland that does a lot of work with corporations, she mentioned it in a recent forum, game's over. Basically once it becomes a medication, then employers are going to have to accommodate. There's a U.S. Supreme Court ruling that I mentioned earlier that it's still classed as a Schedule I drug. And then the Oregon and other state Supreme Courts have ruled in each and every case, Colorado being the most recent, each and every case they have ruled in favor of the employer that that because it's a Schedule I drug at the federal level, the states are not willing to overlook that, and each of the decisions have been in favor of the employers. I'm oftentimes asked the question, is marijuana addicting? And I usually answer the question with a question. Is tobacco? And of course everybody says, well, yeah, tobacco is, but marijuana is different. Marijuana has 483 active chemicals in the smoke. So one can only assume that some of those chemicals are going to have some addictive properties. And we certainly see at Serenity Lane people coming in for a primary diagnosis of marijuana use disorder, mild, moderate, or severe. And by the time they're coming into our residential program, it's pretty severe. There is a DSM-5. If you're not familiar with that, that's a manual that is used to diagnose psychiatric disorders as well as substance use disorders. And the DSM-5, which came out about a year and a half ago, actually has a diagnosis for marijuana use disorder specific. So that would be an indication that, yes, it does. Now, again, historically, prior to 1998, when the medical marijuana initiative passed, it was a real easy handle. Because it was an illegal act, if a person tested positive, it was a policy violation. And so, it was basically handled as a disciplinary event because of it being illegal. Then when the medical marijuana program came into effect in 1998, we again passed that, and employers started seeing problems with folks presenting their cards after they tested positive, whether it was for a post-accident or a reasonable suspicion or a random. I can remember getting calls from 35 employers over the years back when these things were happening, and they would call and they'd say, well, I got an employee that just tested positive for marijuana and they've got a medical marijuana card. What can I do? And my answer to their question was usually, what's in your policy? And in every single case, nobody had any statement in their policy about how they were going to handle a medical marijuana positive. We now have 25 states that have various forms of medical marijuana initiatives. And then there are 4 states in the District of Columbia that have recreational marijuana, and I think the number that I saw recently was somewhere between 9 and 11 states that in November of next year will be having it on their ballots. Interestingly, Ohio, you may have seen in the news recently, had a measure on their ballot, and it failed. And the primary reason that it failed was that there were 3 or 4 individuals that, as part of the law, were going to be the growers of all the marijuana. So they had financial gain to get from that. Even the people that are in Ohio that are for the legalization of marijuana did not feel that that was an appropriate thing to do. And so I don't want people to think that, maybe we're going to come to our senses, and maybe we will. My hope is that in November of next year, if there are 11 measures on the ballot, that 5 or 6 of them fail, or maybe even more. That would be the best thing that could happen. Where are we today? The good news is, again, as mentioned, the Oregon Supreme Court in April of 2010 ruled that employers do not have to accommodate the medical use of marijuana. There was a case that had gone up about 5 years prior to that out of Klamath Falls that the judges on the Oregon Supreme Court, the first question they asked is, does the individual have a qualifying medical condition? He did not. Therefore, because he did not, they threw that case out. And it took about another 4 or 5 years to get the second case that came up out of Springfield. It was I'm trying to remember the company, but anyway, he was a temporary employee that they wanted to hire full-time. They went to hire him full-time, gave him a drug test, and he tested positive for marijuana. So he had already been working for him, on a temp basis with marijuana in his system. And that case went up through the Oregon Court of Appeals and Boley, and then when it got to the Oregon Supreme Court, he did have a qualifying medical condition, but the Supreme Court said that's not good enough, which was a good thing. The bad news, as I mentioned already, is the Board of Pharmacy has changed the scheduling. I think we're the only state that I'm aware of that we have changed it from a Schedule 1 to a Schedule 2. So we're recognizing that it does have some medical properties and medical use. But and again, if that happens at a federal level, that could be a game changer. Possible good news, public sentiment towards legalization. In 2010, it was about 42%. In 2014, it was about 58%, a significant shift. It is currently around 52. So that was the last figure I saw. The good news there is that hopefully people are beginning to recognize that this may not have been the wisest decision in Colorado to make, for example, or in the state of Washington. I think our law here is new enough yet that people haven't come to that realization. But you know, I'm hoping that a few years down the road that there will be enough information that will suggest that that probably was not a good idea. What's next? You know, now that recreational marijuana is legal, I think we're going to see the same kinds of issues that happened in Colorado and in Washington. And we'll talk, I'll mention that in a minute. Colorado Supreme Court just recently was the most recent decision around the medical marijuana not needing to accommodate, the employers not needing to accommodate. Colorado's experience, adolescent use has increased. Emergency room admissions are higher. Typically those are because of the edibles. And the problem with the edibles, you have people that maybe have not had a history or an experience with the drug. They eat a couple of gummy bears. And by the way, in the state of Colorado, gummy bears that are sold that have THC in them, the recommended dosage is 1/2 of one gummy bear. Now, I don't know how many kids are going to eat a half a gummy bear, or how many adults for that matter, but let's say you do eat the half a gummy bear, and it goes into the stomach. It takes a half hour, 45 minutes for it to be digested, absorbed into the blood, carried to the brain where the altered state of consciousness begins to occur. And so people will eat it. If they're not getting high, and they'll say, well, I need to eat more, and they eat more. We had a case at Sun River where a family had traveled down from Washington State, and a lady had some gummy bears, and that exact thing that I just described happened. And she actually overdosed, and they called the EMTs. When the EMTs got there, they evaluated the situation, thinking that she was overdosing on heroin because her behavior and actions were very similar to a heroin overdose, which they see a lot. And then traffic fatalities and THC DUIs are also higher, have increased. The big question for employers is obviously when someone's using marijuana medically or recreationally, are they fit for duty? Because that's what it's all about. Employers are charged with maintaining a safe work environment. Obviously, if a person's questionably fit for duty for whatever reason, those that sat through my training on reasonable suspicion, you know, it could be a diabetic that's got a blood sugar that's off kilter, and they become disoriented, they become, you know, their speech is slurred, they have the appearance of somebody that might be under the influence of alcohol, but they're not. So employers have a duty and an obligation to correct that situation so they don't harm themselves or harm someone else. Alcohol versus marijuana. Here's where the challenges set in. I mean, we have a non-invasive way of measuring the amount of alcohol in the blood. You know, with the evidentiary breath test. Anybody out there that has a third-party administrator that's, or a collection organization that's doing your collections for you, they'll be trained in, you know, an evidentiary breath test. And when that person exceeds 0.02, all CDL drivers are taken out of service for 24 hours at a 0.02. And what the breathalyzer tells you is how much alcohol is in the blood. So we have a way of measuring that without actually taking the blood. The preferred method for testing for THC is through the urine. And as I've already mentioned, all the court decisions have been evidence of past use does not mean that the person was impaired at the time the test was taken. So that kind of, currently we don't have the technology to. There are some organizations, Washington State University being one of them, that are frantically trying to develop a breathalyzer to determine the amount of THC in the blood. I was in a meeting the other day with some more scientific-minded people than myself, and they were of the opinion that it may be a difficult task because THC does not vaporize. Once it's in the body, it attaches to fatty tissues in the body. it's fat soluble and it's in the fatty tissue. Therefore, it may be very difficult to pick it up in the breath. So, I think that's maybe one of the reasons why we haven't seen a breathalyzer. Hopefully, something of that nature will come along. However, when it relates to impairment, Washington State, as it relates to driving under the influence, legislatively passed that if a person has 5 nanograms in their blood, so let's say a person is stopped, they're charged with probable cause of driving under the influence, the law enforcement in Washington State has the liberty to take them into a hospital, have blood drawn, and if they hit a threshold of 5 nanograms, they're charged with driving under the influence. A few months ago, a question came up with where did they come up with that nanogram level, because those of us that are in the field have not seen anything, and they basically pulled it out of the air. It's not something that they can scientifically defend. And then there was a recent Arizona Supreme Court ruling in which the Supreme Court threw out a charge of driving under the influence because the state couldn't meet the burden of proving that the guy was impaired at the time of the test being taken. I was in a meeting yesterday with some law enforcement officers, and it's basically the issue came up of how it's playing out in the state of Oregon with charging drivers with driving under the influence. They've been doing it, but as was stated, they're losing more cases than they're winning. That most people are getting off because of the burden of not being able to meet the burden of proving the person was impaired. We don't have the luxury in this state yet to draw blood for it. And impairment, it's important for everybody to understand that impairment is measured by the amount of a substance in the blood. And I think most employers are uncomfortable, taking blood or drawing blood. Not that some don't, but it's probably not something that it's sometimes looked at as an unreasonable search. When we do have, and hopefully we will have, a technology that will measure the amount of THC in the blood, we still don't have a standard that is equal to, let's say, 0.04 or 0.08 with alcohol. And I think, and again, another meeting I was in the same one I was talking about earlier, in terms of the metabolite of THC maybe is not able to be vaporized. One of the experts in the room said it could take anywhere from 10 to 15 years for that kind of technology or that kind of defendable evidence comes up or is finalized. The current status, if you're regulated by the federal government, hallelujah, because basically you're justified in prohibiting the use of marijuana for a person testing positive. So, with the Department of Transportation, there's no exception. CDL drivers cannot test positive for THC and get a green light. Hospitals that receive Medicare and Medicaid, they certainly can have a zero tolerance, and there are others. The interesting thing back to hospitals, you could have a registered nurse working in a hospital and tested for some kind of cause, let's say, test positive for THC, and if there's zero tolerance, they terminate that nurse and report her back to the Board of Nursing. The Board of Nursing has taken a stance that is equal to alcohol unless the nurse has demonstrated impairing behavior at work. They will not take action against her license or his license. That licensed nurse then can then go on to another employer, another hospital, and have an actively usable license to practice. And then, unlike the medical use of marijuana, there have been no court decisions, and we need a test case. Once we have that test case, and I would encourage you to be looking for that, once we have that test case, it's going to allow us to be able to look at that and to say that's the reason why we maintain a zero tolerance. concerns to consider, obviously, hello. With it now being decriminalized, again, urine test just indicates the presence. And so it doesn't indicate impairment. Therefore, if a citation is issued, like in law enforcement, where a licensing board or employer took corrective action, it could be viewed as wrongful. And that's, again, the test case that we need to have in order to have case law to kind of defend why we're taking a zero-tolerance posture. And I know a lot of you out there that are listening are taking a zero-tolerance policy, and I think that's a great, place to start. I hope you're not the test case. Somebody is going to be, in my humble opinion. Zero tolerance. Non-federally regulated employers, licensing boards may want to take a more cautionary approach until it's been sorted out and the results of future legal challenges. My advice would be to take things slowly. Your decisions should be based on case law. Look for science to develop a measure for THC in the blood without an invasive procedure. And then I would base my consequences on the documented and defendable science-based evidence regarding what the THC in the blood constitutes impairment. It'll come, it's just going to take a while. Some of the options to consider, maintaining a zero tolerance would be very advisable to make a statement in your policy to indicate how you're going to respond to a positive test for THC. Also, educate your employees. I know some of you already have, and I think that's really advisable. Some of you have maybe had them sign off on knowing, I've had several employers, that have indicated that what we're concerned about is your fitness for duty. What you do on your time is your business. A couple of those have been public employers. But if you come to work, you have some of the indicators that would cause us to be concerned, and we test you and you test positive for THC. I might add that, that's obviously if they're showing some impairing symptoms or indicators and they do test positive, it's an argument for possible current impairment. But again, the courts have not come to the conclusion that a urine test will do that. And then obviously the other option is to do nothing, and I think without saying it, it's not an advisable thing to do. One of the things that you don't want to know about probably is a recent Johns Hopkins University study basically found that because of the strength of the marijuana today, two things. Individuals can attain a mild contact high from passively inhaling marijuana, and several of the individuals in the study tested positive for THC and did not ingest the drug. It was passive. We've been able to say for years that somebody that's saying, well, I was in a room where it was smoked, I didn't smoke it, there was no evidence or indication. In fact, all the scientific evidence up to that point had pointed, no, that's not possible. In fact, one study that they did, they had a room the size of a phone booth, and there was heavy, heavy, heavy smoke, and they couldn't attain the threshold for an initial positive for THC. Well, that may not be the case anymore. So I don't look for this to be well known, but I wouldn't be at all surprised to see somebody come up with it in a point of challenge in the future. That's not what the Johns Hopkins University study said, medical school study. With that, I would take do we have time for questions? Well, we obviously have time. We're a little, we didn't go a full hour, but I would entertain any questions that you might have if you're prepared to do that. And Brenda, I'll leave it up to you.
Yeah, it doesn't look like we have any questions at the moment.
I think we're going to be feeling our way along for a while. My hope is that we get some clarity at some point. in the not too distant future. Unfortunately, I'm afraid that there are some employers, and I'm guessing that I'm preaching to the choir today, but there are some employers that have decided that they, number one, want to take the marijuana metabolite out of their panel so that they don't test for it, or they want to change the threshold level for a positive if they're not regulated by federal government. All of those are kind of surrendering to the problem, in my opinion. So we went a little quicker than normal, but any?
No.
Okay, there's no questions, so thank you very much.
Thank you.
Take care and good luck.